If you wake up every morning or finish every afternoon with heavy, swollen ankles, puffy feet, tight socks leaving deep red indents, or aching lower legs, pay close attention. Peripheral edema, or chronic fluid retention in the lower extremities, is one of the most common and distressing health challenges experienced by adults over 60.
Pitting edema.
As we navigate through our
Venous
golden
congestion.
years, gravity works relentlessly against our
Peripheral
vascular
edema.
system, causing metabolic fluid and stagnant venous
Gravity pulls
blood
venous
to
blood and
pool
fluid
in our
into
lower
leg
limbs.
capillaries,
Most
causing
seniors
vessel wall
assume that
leakage, a
swollen
result of
ankles
increased venous
are simply
pressure
an
and capillary
uncomfortable
distension.
inconvenience of aging, or rely solely on tight compression socks and water pills to manage the symptoms. In clinical internal medicine, we recognize that swollen legs indicate a fundamental failure of your body's natural venous pumps and lymphatic drainage pathways. Your lower leg muscles, particularly the gastrocnemius and deep soleus muscles, function as your body's vital second heart, designed to pump venous blood upward against gravity. When prolonged sitting, muscle atrophy, or vascular valve weakness prevents these muscle pumps from contracting, fluid leaks through capillary walls into surrounding subcutaneous tissue. This trapped fluid causes painful swelling, skin tightness, cold, numb feet, and significantly increases your risk of skin breakdown, ulceration, and dangerous blood clots. The encouraging medical truth is that you do not need to endure heavy, aching legs or rely indefinitely on restrictive compression garments to find relief. Vascular biomechanics proves that specific, targeted muscle pump exercises can immediately drain trapped fluid and reactivate stagnant venous circulation right from your chair. By performing 5 gentle, surgeon-backed seated exercises daily, you ignite your second heart, restore venous valve elasticity, and stimulate natural lymphatic flushing. These 5 clinical movements compress deep leg veins like a hydraulic pump, launching pooled fluid back toward your heart and restoring light, energetic legs. Instead of subjecting your cardiovascular system or aging joints to strenuous exercise, this protocol utilizes low-impact, rhythmic muscle contractions to flush swelling safely. Within minutes of performing these 5 specialized movements, interstitial fluid pressure drops, swelling subsides, skin tightness vanishes, and warm oxygenated blood revitalizes your feet. You do not have to accept swollen, heavy legs, fear sudden mobility loss, or feel restricted by chronic ankle swelling as the years advance. Your vascular endothelium and lower extremity lymphatic vessels maintain an incredible capacity to respond, dilate, and flush fluid when stimulated with proper movement cues. In this comprehensive vascular health guide, Dr. Robbert will decode the exact medical mechanisms behind leg swelling and guide you through every step. You will learn how each of these 5 simple exercises directly activates deep venous pumps, repairs fluid drainage pathways, and restores comfortable leg function. These gentle exercises take less than 10 minutes each morning, require no special athletic equipment, and can be performed effortlessly in the comfort of your living room. By integrating this simple vascular routine into your daily schedule today, you can eliminate ankle swelling, prevent dangerous fluid pooling, and step into every day with confidence. Before we demonstrate the first fluid-draining exercise together, let us perform a detailed medical analysis into the anatomical causes of lower extremity swelling. Let us examine how venous valves prevent backflow, how calf muscle pumps drive blood upward, and how interstitial fluid dynamics create ankle edema. Understanding these internal vascular mechanics empowers you to take full, educated control over your circulatory health, protecting your legs from chronic swelling. Sit back comfortably in your chair, take a slow, deep breath, and prepare to discover the transformative exercise blueprint that will set your legs free from swelling. In the next section, we will analyze the cellular structure of venous valves and introduce the first gold standard exercise to ignite your second heart pump. We will demonstrate how targeted isometric calf engagement compresses deep veins without placing any stress on your knee or ankle joints. Together, we will replace temporary Band-Aid solutions with surgeon-backed vascular restoration protocols designed to keep your legs light, slender, and completely pain-free. No matter how many years you have struggled with heavy, swollen ankles, your body retains the innate biological capacity to flush fluid when given the right stimulus. Let us begin this empowering journey toward total vascular revitalization and light, energetic legs right now. The first gold standard exercise that activates your body's second heart and drives trapped ankle fluid upward is the seated Soleus Tiptoe Surge. The soleus is a broad, deep muscle lying beneath your outer gastrocnemius calf, containing specialized venous sinuses that act as a powerful internal hydraulic pump. When you perform a targeted tiptoe extension while seated, the soleus muscle contracts forcefully against the floor, compressing deep calf veins and forcing pooled blood upward toward your heart. To execute exercise 1, sit upright on the front half of a sturdy wooden chair with your feet placed flat on the floor, hip-width apart. Keep your toes firmly grounded on the floor while slowly driving both heels upward as high as physically possible, feeling your deep calf muscles tighten intensely. Hold this elevated peak contraction for 3 full seconds, while maintaining continuous breathing, allowing high intramuscular pressure to squeeze deep venous vessels shut and launch stagnant blood upward. Lower your heels back to the floor over a controlled 2-second phase, allowing your venous sinuses to refill with fresh blood before the next compression. Repeat this powerful tiptoe surge for 15 smooth, rhythmic repetitions, taking a deep breath between each extension to support venous return. This targeted deep calf pump immediately reduces swelling around your Achilles tendon, lowers venous pressure, and restores light, energetic sensations to your ankles. The second gold standard exercise that flushes fluid from the front of your ankles and stabilizes your stride is the seated Tibialis Shin Lift. The tibialis anterior muscle runs along the front of your kangchun, controlling ankle dorsiflexion and supporting the lymphatic drainage network along the top of your foot. When this muscle remains inactive from prolonged sitting, fluid accumulates in the anterior ankle capsule, causing puffy foot tops and making your feet feel heavy and clumsy. Remain seated upright on your chair, keep your heels firmly pressed into the floor, and lift both forefeet and toes upward toward your shins as high as possible. Hold this peak shin contraction for 3 full seconds, feeling the muscles along the front of your legs tighten and pull trapped fluid out of your foot arch. Lower your toes slowly back to the floor, immediately resetting your foot position before initiating the next rhythmic shin elevation. Complete 15 controlled repetitions, synchronizing each upward toe lift with a calm, smooth exhalation through your mouth. This anterior activation drains trapped tissue fluid from the front of your feet, increases lymphatic capillary suction, and prevents foot drop during walking. By combining the seated Soleus Tiptoe Surge with the seated Tibialis Shin Lift, you create a powerful dual-action venous pump across the entire lower leg. This dual pump action drives trapped interstitial fluid out of subcutaneous tissues, lowers capillary hydrostatic pressure, and visibly shrinks ankle swelling in under 3 minutes. Let us now prepare to explore the third gold standard exercise, engineered to activate the posterior knee muscle sleeve and drain fluid trapped behind your knees. In the next section, we will analyze how posterior leg activation clears popliteal fossa stagnation and prevents fluid from backing down into your calves. We will also demonstrate how proper hamstring engagement supports total leg blood flow without straining your knee joint cartilage or lumbar spine. Eliminating lower extremity fluid retention through these 2 targeted exercises provides your vascular system with the exact mechanical support needed to restore healthy blood flow. By committing to this surgeon-backed daily routine, you take proactive control over your circulation, ensuring your legs remain slender, comfortable, and pain-free. Together, we will continue replacing temporary Band-Aid fixes with clinical movement protocols designed to keep your legs light, active, and vibrant. No matter how many years you have suffered from heavy, swollen ankles, your vascular system retains the biological capacity to respond and flush fluid. Let us advance to the next phase of our vascular restoration protocol and unlock the remaining gold standard exercises together right now. The third gold standard exercise that clears fluid trapped in the popliteal space behind your knee and prevents downward capillary leaking is the seated heel drag with popliteal flushing. When you sit for prolonged hours, bending your knees creates a mechanical fold in your popliteal vein and lymphatic vessels, severely restricting venous return from your lower calves. This targeted isometric dragging movement engages your hamstring tendons and popliteus muscle, dynamically opening the popliteal space and milking trapped venous blood upward past your knee joint. To perform exercise 3, sit near the front edge of your chair with an upright spine, extend your right leg forward, and place your heel firmly on the floor. Flex your right ankle back toward your shin. Dig your heel into the floor and forcefully pull your heel backward toward your chair without moving your foot. Hold this powerful isometric backward pull for 5 full seconds while maintaining continuous breathing, feeling your hamstrings contract and pressure release behind your knee. Release the backward tension gently, take a calm breath, and complete 8 to 10 controlled repetitions before repeating the exact same movement sequence with your left leg. This friction drag flushes accumulated popliteal fluid, restores full venous diameter behind your knee, and stops fluid from backing down into your ankle tissues. The fourth gold standard exercise that breaks up stubborn, hardened fluid deposits around your ankle bones and stimulates localized lymphatic drainage is the seated ankle circles with multi-directional pumping. Micro-lymphatic capillaries surrounding your medial and lateral malleolus ankle bones lack muscular walls, relying entirely on multi-directional articular movement to open their entry valves. Executing full 360-degree ankle rotations stretches surrounding fascia in every plane, creating a localized suction effect that draws trapped interstitial protein fluid into your lymphatic network. Sit upright on your chair. Lift your right foot slightly off the floor and rotate your ankle in smooth, wide clockwise circles for 10 full revolutions. Pause briefly, then rotate your right ankle counterclockwise for another 10 wide revolutions, ensuring you trace the largest possible motion circle with your big toe. Lower your right foot, take a refreshing breath, and execute the exact same multi-directional rotation sequence with your left foot. This continuous rotational movement breaks up stagnant, protein-rich fluid pools around your ankle joints, increases localized lymphatic flow, and restores smooth skin contour. By combining all 4 exercises, soleus surges, tibialis lifts, popliteal drags, and multi-directional ankle circles, you systematically purge stagnant fluid from every compartment of your leg. Let us now prepare to explore the 5th and final gold standard exercise, engineered to activate microcirculatory foot pumps and restore warm sensitivity to your toes. In the next section, we will analyze how intrinsic foot muscle contraction flushes plantar venous plexuses and drives oxygenated blood into peripheral tissues. We will also demonstrate how combining these 5 gold standard vascular exercises into an 8-minute morning routine keeps your legs slender, light, and pain-free permanently. Eliminating chronic fluid retention restores capillary elasticity, reduces subcutaneous tissue strain, and protects your skin from inflammatory breakdown. By committing to this surgeon-backed daily protocol, you give your vascular system the exact mechanical assistance required to maintain flawless venous return. Together, we will continue replacing temporary compression garments with clinical movement protocols designed to keep your legs light, active, and vibrant every single day. No matter how long you have struggled with heavy, swollen ankles, your lymphatic and venous networks retain the biological capacity to drain and adapt. Let us advance to the next phase of our vascular restoration protocol and unlock the final gold standard exercise together right now. The fifth and final gold standard exercise that activates your foot's microvascular pumps and restores warm blood flow to your toes is the seated toe curling with plantar venous flush. Underneath the arch of your foot lies the plantar venous plexus, a dense network of microvessels that acts as the initial launching pad for blood returning up your leg. When you curl and spread your toes rhythmically, intrinsic foot muscles contract firmly against these vessels, compressing the plantar plexus and propelling stagnant blood straight into your deep calf veins. To execute exercise 5, sit upright on your chair with your feet flat on the floor and your knees bent at a comfortable 90-degree angle. Flex and curl all 10 toes tightly inward, as if attempting to pick up a small towel from the floor with your bare feet, squeezing your foot arch for 3 full seconds. Release the inward curl and immediately spread your toes wide apart, extending them outward for 2 seconds to allow fresh, oxygenated arterial blood to fill your foot microcapillaries. Repeat this rhythmic curling and spreading motion for 15 controlled cycles, matching each inward squeeze with a smooth, deep exhalation through your mouth. This intrinsic activation clears trapped fluid from your toes, stimulates peripheral plantar nerves, and eliminates that uncomfortable, cold, numb sensation in your feet. Now that we have covered all 5 fluid-draining exercises, we must address the 5 critical lifestyle errors that quietly sabotage your vascular recovery and cause swelling to return. The first critical error is consuming high-sodium processed foods that disrupt your body's fluid balance and force your kidneys to retain excess water in your subcutaneous tissue. Excess sodium elevates fluid pressure inside your bloodstream, forcing metabolic water through capillary walls directly into your ankles and lower calf tissues. Shift your daily diet toward potassium-rich whole foods like leafy greens, bananas, and avocados to balance sodium levels and promote natural kidney fluid excretion. The second major mistake is wearing restrictive socks with tight elastic bands or narrow shoes that create a physical tourniquet around your ankles or calves. Tight elastic bands restrict superficial lymphatic channels and venous vessels, blocking upward fluid flow and causing severe localized swelling right above your sock line. Opt for non-binding, wide calf diabetic socks and comfortable, well-cushioned footwear that allow unrestricted venous blood flow and natural lymphatic drainage. The third critical error is crossing your legs at the knees or ankles while sitting for extended periods throughout the day. Crossing your legs places direct mechanical pressure on your popliteal and femoral veins, creating a vascular bottleneck that causes rapid fluid pooling in your lower extremities. Maintain flat foot placement on the floor with your knees uncrossed, keeping your hips and knees aligned to support open, unobstructed venous return. The fourth major error is sitting continuously for hours without taking short movement breaks or elevating your feet when resting in the evening. Prolonged immobility disables your calf muscle pumps, allowing gravity to pull fluid down into your feet continuously throughout the afternoon. Set a gentle hourly reminder to stand or perform a quick 2-minute set of seated soleus pumps, and elevate your legs on a plush cushion when relaxing in the evening. The fifth critical mistake is failing to drink adequate fresh water, under the false assumption that drinking less fluid will reduce lower extremity swelling. When you become dehydrated, your body releases antidiuretic hormone, forcing your tissues to hold on to fluid and making lower leg edema significantly worse. Drink fresh water consistently throughout the day to support kidney function, flush excess sodium, and keep your vascular endothelium hydrated and healthy. By eliminating these 5 lifestyle mistakes, you stop the continuous buildup of fluid in your lower extremities and double the effectiveness of your daily exercises. Combining proper nutrition, loose clothing, uncrossed seating, regular movement breaks, and structured hydration creates the ultimate internal environment for slender, light legs. In the next section, we will integrate these 5 fluid-draining exercises into a seamless, step-by-step 30-day clinical action blueprint for your daily morning routine. You will learn how to structure your daily habits to achieve maximum venous pumping, lymphatic flushing, and permanent relief from ankle swelling in under 10 minutes a day. Together, we will continue replacing temporary Band-Aid fixes with surgeon-backed vascular protocols designed to keep your legs light, active, and completely swelling-free. Welcome to the fifth phase, your complete 30-day clinical action blueprint to permanently eliminate leg and ankle swelling. In vascular medicine, brief daily activation of your muscle pumps is exponentially more effective than sporadic, exhausting workouts that strain aging blood vessels. Begin every single morning immediately upon waking by drinking a tall glass of fresh room temperature water to jumpstart kidney filtration and flush overnight metabolic sodium. Sit upright on a sturdy wooden chair with your feet flat on the floor and execute 15 smooth repetitions of the seated Soleus Tiptoe Surge to ignite your second heart. Follow immediately with 15 repetitions of the seated Tibialis Shin Lift, lifting your toes high to pull trapped fluid out of your anterior ankle capsule. Next, perform 8 to 10 repetitions of the seated heel drag per leg, digging your heels into the floor to clear popliteal vein congestion behind your knees. Transition smoothly to 10 wide clockwise and counterclockwise seated ankle circles per foot to stretch ankle fascia and trigger micro-lymphatic suction. Conclude your morning routine with 15 cycles of seated toe curling with plantar venous flush, squeezing your foot arch to propel blood out of your plantar plexus. This complete 5-exercise routine takes under 8 minutes each morning, establishing an unshakable foundation of open venous pathways and continuous fluid drainage for your day. Throughout your daily activities, maintain conscious awareness over your sitting habits, keeping your legs uncrossed and avoiding tight, non-breathable footwear or socks. Set a gentle hourly reminder on your phone to stand up, take 3 deep diaphragmatic breaths, or perform 10 quick seated tiptoe raises to keep calf pumps active. In the afternoon, enjoy a light, anti-inflammatory meal rich in potassium, dark leafy greens, and antioxidants to strengthen capillary walls and prevent fluid leakage. During your evening unwind time, elevate your legs slightly above heart level on a soft ottoman or pillow for 15 minutes, letting gravity assist venous return. Prioritize 7 to 8 hours of restful sleep every night, as endothelial tissue repair and microvascular restoration peak during deep sleep cycles. Within the first 7 days of adhering to this daily blueprint, you will notice a dramatic reduction in afternoon ankle puffiness, skin tightness, and sock indents. Between days 8 and 20, as your venous valve tone improves and lymphatic drainage accelerates, your legs will feel visibly slender, light, and completely pain-free. By day 30, fully restored calf muscle pumps and strengthened capillary walls will empower you to stand, walk, and enjoy your daily life without swelling fears. Always remember that vascular longevity is a continuous biological journey that rewards gentle, consistent daily movement rather than sudden, aggressive overexertion. Listen attentively to your body's signals, honor your daily physical progress, and take deep pride in every light, energetic step you take toward total independence. Let us now transition into our clinical doctor FAQ section, addressing the most critical, frequently asked questions about leg swelling and vascular health after age 60. Our first essential question addresses whether seniors with varicose veins or chronic venous insufficiency can safely perform these 5 seated muscle pump exercises. Dr. Robbert will explain why low-impact, unweighted isometric contractions are actually the gold standard medical therapy for relieving pressure in varicose veins. Our second question explores whether drinking more water actually helps reduce lower extremity swelling or if fluid intake should be restricted during edema episodes. Dr. Robbert will clarify the essential medical distinction between systemic hydration and localized tissue fluid retention to guide your daily fluid habits safely. Our third question tackles how to distinguish between normal fluid drainage sensations and dangerous warning signs of deep vein thrombosis or sudden cardiovascular distress. Dr. Robbert will share vital clinical warning signs to ensure you navigate your vascular recovery routine with complete safety and confidence. Welcome to the final phase of our Vascular Health Masterclass, where Dr. Robbert addresses advanced doctor FAQ questions and guides you through your sign-off blueprint. Our fourth Doctor FAQ question asks, can seniors with diabetes or peripheral neuropathy safely practice these 5 seated muscle pump exercises? Dr. Robbert emphasizes that these low-impact seated exercises are exceptionally beneficial for diabetic seniors, as they stimulate microcapillary circulation without risking skin trauma or foot pressure sores. Rhythmic muscle contractions drive warm, oxygenated arterial blood into peripheral nerve fibers, relieving sensory numbness and supporting small blood vessel health throughout your feet. Our fifth FAQ question addresses whether wearing compression socks during these daily chair exercises enhances fluid drainage or restricts natural muscle pumping. While compression socks provide beneficial external pressure during long periods of standing, removing them during your active 10-minute exercise routine allows full, unrestricted muscle fiber expansion. Allowing your calf muscles to contract and expand naturally against atmospheric pressure maximizes internal venous sinus squeezing and accelerates lymphatic vessel suction. Our sixth Dr. FAQ question tackles timing. Is it better to perform these 5 exercises immediately upon waking or right before evening bedtime? Performing your 10-minute routine in the morning flushes overnight fluid accumulation, while practicing in the evening prevents fluid from backing up into your lower back while lying down. For maximum vascular benefit, perform your primary routine every morning after drinking a glass of water, and execute a quick 5-minute calf pump set before resting in the evening. Our seventh FAQ question asks how quickly seniors can expect to observe visible reductions in ankle swelling and sock indents. Most aging adults report noticeable relief from skin tightness and lower leg heaviness within 24 to 48 hours of starting daily Soleus and Tibialis pumps. Visible reduction in ankle circumference, clear definition around ankle bones, and elimination of deep sock indents typically manifest between days 7 and 14 of consistent practice. By day 30, your vascular endothelium and lymphatic drainage channels adapt to this daily stimulation, giving you permanently slender, comfortable, and energetic legs. As we conclude this comprehensive vascular guide, Dr. Robbert wants to leave you with an empowering message of biological hope and circulatory resilience. Never let anyone convince you that heavy, swollen ankles, tight, puffy skin, or cold, numb feet are inevitable consequences of advancing calendar years. Your lower leg veins, one-way venous valves, micro-lymphatic channels, and skeletal muscle fibers retain a remarkable biological capacity to adapt, drain, and flush fluid at any age. By eliminating high-sodium processed foods, tight restrictive socks, and crossed-leg seating, you instantly remove the primary mechanical barriers to healthy blood flow. By committing just 10 peaceful minutes every morning to Soleus surges, tibialis lifts, popliteal drags, ankle circles, and toe flushes, you actively keep your second heart pumping. Listen attentively to your body's subtle signals, honor your daily physical progress, and celebrate every light, effortless step you take toward total physical freedom. Share these surgeon-backed vascular secrets with your family, friends, and community to inspire everyone around you to live active, swelling-free lives. You now possess the complete clinical biomechanics, the 5 gold standard vascular exercises, the daily 30-day action blueprint, and expert doctor guidance to restore your circulation. Take charge of your vascular health today. Ignite your lower leg muscle pumps, flush trapped fluid, and reclaim the light, energetic legs you truly deserve. This is Dr. Robbert, wishing you radiant physical health, resilient blood vessels, slender ankles, and a steady, confident stride every single day of your life.